Respiratory disorders are among the most common causes of illness and hospitalization in children. Because it is such a common cause of childhood illness and hospitalization, 2020 national health goals have been established for children with respiratory illnesses. Reducing the incidence of respiratory illnesses in children could help to greatly reduce the number of emergency room visits and school days missed. Nurses can help achieve these 2020 health goals by teaching children ways to avoid respiratory infections. There are many prevention strategies such as good hand hygiene and up-to-date immunizations that will have a big impact in preventing respiratory illnesses. The respiratory system is separated into two divisions. The upper respiratory tract, which is composed of the nose, pharynx, larynx, and epiglottis. The lower respiratory tract is composed of the bronchioles, and alveoli. Respiration is separated into two parts, inspiration and expiration. Inspiration delivers warmed and moistened air to the alveoli. Expiration causes carbon dioxide-rich air to be discharged to the outside. The intercostal muscles and the diaphragm help the act of respiration. During inspiration, the diaphragm contracts and moves lower and the chest expands. This reduces the pressure inside the lungs, allowing air to move in. During exhalation, contraction of the intercostal muscles and relaxation of the diaphragm increases the pressure in the lungs and helps push air out. The difference in partial pressure of oxygen and carbon dioxide helps facilitate the movement of oxygen into cells and carbon dioxide out of cells. The upper respiratory tract is constantly exposed to a range of foreign organisms, including pathogens. This leads to a variety of airway irritations and infections such as nasopharyngitis, epistaxis, sinusitis, and laryngitis. Congenital malformities also cause some upper respiratory tract disorders. Examples include choanal atresis and tracheomalacia. The lower respiratory tract is subject to infection by the same pathogens that attack the upper respiratory tract. Pathogens usually cause inflammation of the lower respiratory tract, and they lead to influenza, bronchitis, and bronchiolitis. Asthma is a chronic inflammatory disorder and is the most common chronic illness in children. Because children are still growing, they have some important differences in respiratory anatomy and physiology from adults. Infant airways are shaped like a funnel, with the narrowest portion at the coracoid cartilage rather than the vocal cords, as in an adult. This narrowness increases resistance if obstruction or swelling occurs. Infants have large occiput, which, when compared to adults, which can obstruct their airway. The lung is large in proportion to their mouths and can easily move and obstruct the airway. Infants have a smaller amount of smooth muscles in their airway, so they do not develop bronchospasms as readily as older children or adults. Therefore, wheezing will not be a prominent finding in infants until the airway is severely compromised. An assessment of respiratory illness on a child holds many components. They include physical examination, history taking, potential laboratory testing. For the physical assessment, nurses should first observe the child. Look at how they act, interact, and move. How's their respiration? Do they have a cough? Are they restless or cyanotic? Then the nurse can auscultate and assess areas that cannot be seen easily. Laboratory testing can help to confirm or rule out certain respiratory disorders and help to identify the cause and severity of the problem. Those tests include ABGs, radiographs, nasopharyngeal cultures, pulmonary function testing, and sputum analysis.